Pelvic Floor Awareness Meditation. Cultivating awareness is one of the first steps to change. Breath and body awareness practices can be effective methods for things like pain reduction in people suffering from persistent or chronic pain. I offer this pelvic floor awareness meditation practice for those who are living with persistent pelvic pain and have found it to be a valuable and successful technique to help calm the nervous systems, reduce the threat input, and modulate the pain experience, which is essential prior to introducing challenging movement practices. It's important that the position you are in when you do this practice feels as comfortable, safe, and supportive as possible for you, without experiencing physical or mental distress. One position that many people find helpful to promote pelvic floor awareness is the supported and extended child's pose. You can start on your hands and knees, bringing your big toes touching together with your heels and your knees apart. Sinking back or sitting back onto your heels. And you can place a bolster or a rolled blanket in between your thighs and gently contacting your perineum to provide some tactile feedback. And then you allow the weight of your trunk to fully rest onto the bolster or the blanket in front of you. Be sure to adjust the height so it feels as comfortable and fully supportive as possible. So you may need more blankets or another bolster. Blankets behind your knees or under the ankles may also be required for added comfort. You may want to check out a free video that I have demonstrating this position and its modifications on my YouTube channel. The link is below under the description. And if you're unable to get into this position, other options such as supported lying positions like on your back, on your side, or on your stomach can also be used. Or a seated position at the edge of a chair with your legs apart and the trunk relaxing forward with the arms and trunk supported on a table or on a few pillows or bolsters that are stacked on your lap. That can also be an option. The cueing used in the following pelvic floor awareness meditation practice assumes this supported and extended child's pose. Remember to give yourself permission to pause and adjust your position at any time during the practice if you need to. Bring your awareness to your breath without trying to change it. Notice the rhythm. Is it fast or slow or medium? Notice the depth, shallow or deep. Notice the texture of your breath. Is it rigid or bumpy or smooth or soft? Or any other qualities that you may notice about your breath. Resist the temptation to try to change anything. Just notice. And notice the length of your inhale compared to the length of your exhale. And notice how your breath moves your body. How does your body respond to the breath rhythm? Upon inhaling, allow your belly to naturally expand outwards as it descends towards the earth. And on exhalation, notice how it returns to its resting position. Just noticing the natural rhythm and movement of your abdomen in response to the breath. Now bring your awareness to your pelvic floor. Visualize your pelvic floor and its connections from the tailbone at the back, expanding to your two sit bones, connecting to the sides of the pelvis and to the pubic bone in the front, like the shape of a diamond. And see if you can notice how your pelvic floor moves in sync with your breath rhythm. And it's okay if you can't feel it right away. You can even just imagine that you are allowing your pelvic floor to naturally descend, so it goes downwards, and it expands and widens as you inhale. And then visualize your pelvic floor recoiling passively as it goes back up and in, as it draws up and in on your exhalation. Just exploring and even having some fun with it. You don't have to take yourself too seriously. Just allow this natural rhythm and movement to emerge. Descending on the inhale and then going back up on the exhale. Do not force or push your pelvic floor down on inhalation. It will do this on its own as you allow. And perhaps you can even feel the subtle rhythmical movement from the feedback of the bolster or the blanket that's against your perineum. And as you inhale, maybe there's a little more pressure into the blanket or bolster, and as you exhale, maybe it lessens. Inhaling, visualize your pelvic floor descending, expanding, and receiving the pelvic organs. Exhaling, visualize your pelvic floor returning back up and in to its resting dome-shaped position. Inhaling, allow the pelvic floor to release, expand, and widen. And if it feels safe, see if you can let go what isn't serving you right now. Notice if you're holding tension or guarding or holding back anywhere or in any way. As you exhale, do nothing. Observe any thoughts or judgments or stories that may arise. If you get caught up in a story or notice the mind wandering and elaborating, just compassionately bring yourself back to the present moment, to the present task of noticing your breath rhythm. So inhaling, feeling your abdomen and pelvic floor expand as you visualize both the pelvic and respiratory diaphragms going down. Exhaling, visualizing both diaphragms going up in sync, returning back up and into their dome-shaped positions. See if you can try to allow this natural rhythm of the pelvic diaphragmatic breath to emerge. Notice any tension developing in your body and explore what it means for you to create space, trust, to allow, and to let go. And explore how it feels to introduce an intention that you can silently repeat to yourself along with this rhythm of the pelvic diaphragmatic breath cycle. So when you inhale, you could silently repeat, "I am safe." When you exhale, you could silently repeat, "It's okay to let go." So on the inhale, "I am safe." Exhale, It's okay to let go. I am safe. It's okay to let go. Continue repeating this intention silently at your own pace with your breath cycle for about another minute. Continuing a few more cycles. And release that intention. And if any thoughts or emotions or physical sensations or stories distracted you, that's okay. The next time you practice this meditation, you can always acknowledge those distractions and maybe even thank them for appearing. And then bring your awareness back to the presence of the intention and your pelvic diaphragmatic breath rhythm. Remember that the moment you realize that you have been distracted is the moment that provides you with this golden opportunity to practice compassion towards yourself and discipline to refocus your attention to the present moment awareness. And that is part of this meditation practice. So thank yourself for the practice and do what you need to do to wiggle around and come into another position that you feel relatively comfortable and at ease, and maybe you want to move around a little bit. And congratulations.